Good morning and welcome to our second Care Markets and Quality webinar focused on a place I call home. We have done some sound checks today, but if you're having any difficulties then please do let us know in the chat box. I'm Natasha Burberry, I'm the Policy Advisor for Think Local at Personal, TLAP for short, and in the room with me I have
Clare Skidmore. I'm a Strategic Lead for Influencing and Networks at the Housing Learning and Improvement Network.
I'm Tim Hoyle, I'm from Central Bedfordshire Council.
I'm Isaac Samuels from the National Co-Production Advisory Group, representing the people that access care and support services.
Thank you very much. And just to say a little bit about TLAP and what we do, we're a national leadership body for personalisation and community-based support. We work alongside people with lived experience and carers. And this webinar really follows on from an event that we held recently around care and support in accommodation, and we thought it was a good opportunity to go into depth a bit more about the housing agenda. Just to explain something about the timekeeping, the webinar's been scheduled for 45 to 50 minutes, aiming to finish at 12:15, and apologies for the slight delay in starting this morning. We had some technical difficulties. Our presenters on the panel will present for approximately 10 minutes each, and then we intend to open up for question and answers. In the meantime, please do type in chat comments, but remember not to include any personal information such as email addresses. A place called home is a great topic area and one that's so important to all of us. Home is a place where we should feel safe, be ourselves, where we can be with friends, family and loved ones. But most of all, home is where a community comes together. But if we don't have a place called home, it can really impact negatively on our lives. So Claire, Tim and Isaac are going to explain a little bit more about some of those challenges. So I'm going to hand over to Claire now.
Thank you. So it's my role today to provide a very brief skip through some of the national context with hopefully some useful links and information that you might find useful to follow up later. I'm happy to answer any questions about any of the topics I raise, because we only have a very short time to cover what is a very broad set of topics, and you may be more or less interested in some different aspects of what I'm going to mention.
No sound.
No sound. Okay, so first of all, I just want to look back in time very briefly. In the 19th century, there was a social reformer called Octavia Hill who founded the National Trust, but she was also a housing campaigner, and she really understood that good housing was fundamental to enabling health and well-being. And after she died in 1912, throughout the 20th century, the improvement of housing conditions has played a central role in rising life expectancies and improved health outcomes. And I think often we forget this. Nye Bevan was actually Minister for Health and Housing, which I think recognised that link right at the beginning of the NHS. I also wanted to draw your attention, bringing us right up to the present day, to some new planning guidance which has been issued, which is a new chapter to the National Planning Policy Framework, which states that local planning authorities should be setting clear policies to address the housing needs of older and disabled people. And I wanted to draw this to attention really because it's essential that local authority planners and adult social care and health commissioners, public health leads and people with lived experience engage with each other in order to make the most of this planning guidance, because where a planner is going to get their information about the housing needs of older and disabled people, they will get them from those partners and local people. So that's a really good opportunity for us to kind of seize hold of. I think it was only published in July, so do look it up. I also wanted to just briefly reflect on this question that we always get asked: what's the evidence that housing matters for health and well-being? What's the evidence that investing in housing can lead to better health and care outcomes. And I think it's just worth reflecting on kind of some self-evident truths really, which is if you can't leave your home, apart from maybe for hospital visits, or if you can't really properly parent your own children, or if for any reason your housing situation is uncomfortable or unsafe or isolated, how easy really would it be for any of us to remain active, healthy and mentally well? There's some really good examples, some quite depressing examples, but also some really good qualitative and quantitative evidence in this report, which you can see represented on this slide, which was published by the Equality and Human Rights Commission last year. Another really useful source of information is Habinted's new report, which is looking at accessible housing, and that again presents quite depressing figures about the proportion of the current housing stock which is providing even the most basic accessibility features. It's 7% of the current housing stock. But equally worrying is that the majority of local plans, reflecting again on that planning guidance, actually have no specified requirement for a proportion of new homes to meet any accessible or adaptable housing standards. So clearly we need to do something about this, because it is about future housing stock if we continue to fail to plan ahead. But it's not just about the current and future housing stock and bricks and mortar, it's also about the key role that the housing sector can play in enabling better health and care outcomes. So there are lots and lots of ways, without going into lots of detail, in which housing partners can play a key role in enabling hospital discharges, for example. I haven't got time to go into any of these examples in detail, but if you are interested, do have a look at the interactive map which the Housing LIN developed in Foundations UK, which we will be periodically updating for some really great examples of what might be going on near you. I've just got a couple of specific examples to show you. There's the Lightbulb project in Leicestershire, provides community-based housing support, providing support in a range of ways, including reducing fuel poverty, providing aids and adaptations, providing information and advice about housing options, and much more. And they have undertaken evaluation which shows the savings they've achieved in health and social care utilisation and A&E attendance and so on. There's a case study on the Housing LIN website which you can look up. And another good example is the Derby, another East Midlands example, is the Derby City Council Healthy Housing Hub, which also provides a really fantastic service locally. And I think I just wanted to highlight that it's not just about the operational work that this service does, it also plays an important role in enabling wider integration and partnership and building relationships across health, housing and care. So I also wanted to just highlight, because I'm skipping over a lot of stuff here, that adaptations are an essential aspect of ensuring housing is suitable and accessible to people's varied needs. I want to let you know about the Adaptations Without Delay review, which was undertaken by the Housing LIN and commissioned by the Royal College of Occupational Therapists, which sets out a radically different approach to addressing the delays in assessment and delivery of adaptations. And the link will be added to the slide after this webinar is finished. But also I wanted to just point out the historic lack of focus on design quality, and actually what a lot of adaptations look like, still quite medicalised, whether talking about healthcare or other types of adaptations devices, still have a very institutional appearance. And really we're only beginning to see now some improvements in design quality that makes some of those adaptations more attractive. So again, thinking about design, again I haven't got time to go into detail, but happy design principles were developed by the all-party parliamentary group on housing and care for older people. Started with Happy 1, we're now at Happy 5. All the reports are available on the Housing LIN website, but the happy design principles set an aspirational and positive standard for housing for older people, both specialist and general needs housing, and have definitely set a standard in terms of what good housing for older people looks like. And you will see developments sometimes being advertised as meeting happy standards, so there has been an impact. So looking to the future, there are some really exciting and interesting developments in the world of housing where people are beginning to rethink how they want to live, particularly as they get older, for example, shaping their own housing and creating new ways of living in communities. And there are also really aspirational, positive examples of specialist housing for older and disabled people with really good design embedded from the outset. And again, there are lots of examples on the Housing Link website of where people are actually doing this, often against enormous odds, it has to be said. So some positive scenarios of where housing can make a huge difference. These are just some examples, but people being able to move into bespoke adapted accommodation following a spinal injury, a person with learning disabilities moving into their own home, a person moving into extra care housing without which they might have felt that they had no other choice other than moving into residential care, and a whole range of other really practical examples which, when you reflect, you probably know somebody in your own family or friends circle who have benefited from housing in some way, perhaps one of these ways described here. So in summary, housing is critical to enabling independent living. Quite simply, it impacts on every aspect of our physical and mental well-being and health inequalities. And housing options have evolved to meet new and emerging demands and aspirations and does contribute to community solutions. But it can only really achieve its potential if the partnerships and the relationships exist locally and there's a commitment to working together. And the Housing Link has committed to signing up to making it real, and we will be doing so in the next few weeks. And we are encouraging our 25,000 members and stakeholders to do so as well. If you're not a member of the Housing Link, please do join up. It's completely free, and we do work closely with TLAP, and we are a TLAP partner, also with others working across housing, health and care. So I just want to finish with some questions that you might find useful to reflect on, whether you work in housing, health or care, or whether you are kind of living some of these experiences in your life. What opportunities do you think there are where we could all work more effectively together? What could you personally or your organisation do to influence a more integrated approach? And do you have any good examples of where people are getting this right? If you'd like to share any examples, good or bad, of your own lived experience of this, I know TLAP are interested, and Housing Link is also interested to hear more, and we'd like to continue to profile the best that's going on and the best examples that you can share. And finally, I'll just encourage you to do visit our website and have a look at our free-to-view resources and sign up to receive our bulletin. And we'd love to hear from you if you'd like to write something for us or share any news. Thank you.
Thank you very much, Claire. That was very insightful, and you gave a really good picture of the national context, and there's loads of links there for people to look up. So hopefully you'll go and have a look at the Housing Link website and the best practice examples that Claire's provided. I'm going to hand over to Tim Hoyle now, who's going to talk about the local work in Central Bedfordshire on desirable housing.
Thank you very much. And if you were wondering who was coughing rather irritatingly throughout Claire's presentation, I'm afraid that was me, and I'm going to try and avoid doing it during my bit, but I'll probably start again when Isaac goes on to his. So, just to give you a bit of background about what I'm hoping to do is just to tell you the story about what we've done in Central Bedfordshire. I don't think we're particularly special, or we're way ahead of everybody else, but I would like to think that we have paid some attention to this area, and I'll try and link into some of the things that Claire has said as well. So this is Central Bedfordshire. It's a bit of a strange shape. It was formed in 2009 when Bedfordshire was split into three council areas, of which this is Central Bedfordshire. We have quite a high density in the south, in Dunstable and Leighton Buzzard and Houghton Regis, but in the north it's quite rural, and we've mainly got market towns. And we're relatively affluent, relatively high level of own occupation. The other key thing about Central Bedfordshire is that we are an area that will see some housing growth. We've already seen quite a lot, but we will be seeing a lot more over the coming period to 2035. At the moment we are looking at plans for around 40,000 new houses, but I think most people think that that's likely to increase yet again before we get to 2035. Now that does offer some opportunities. It's not always welcome in particular areas, but it does offer us potentially some opportunities. And as a council, we've always tried to approach the whole market, not just focus on those people who need public support, looking at all housing types, using the assets of the council, of which there are a considerable number, and trying to engage across the marketplace and engage with lots of different providers, both the for-profit and the not-for-profit providers. And as a council, we have our housing authority itself. So we have our own housing stock, and we as a council are investing considerably in that. And some of that, well, that's mainly due to the fact that many of the restrictions that were imposed on councils over the last generation have now been lifted, and so we can start once again to directly invest in developing new housing for people. So we've started. We've made some achievements. We're looking at replacement care and nursing homes. We're looking at delivering housing with care and housing with support schemes, both for older people and for adults. And we're now turning our attention to the needs of especially those working age people with learning disabilities, and making sure that they're appropriately accommodated and have the opportunities that we want for them. But there are a couple of areas where we've not made as much progress as we would have liked. The first one is new homes suitable for older people, so open market, what generally call mainstream housing that's suitable for older people. And also in terms of the specialist housing area, things like extra care and sheltered housing. The new developments have generally been at the affordable end of the market rather than in the middle or upper end. So one of the things that we did was we wanted to think about how we could get the market to respond. We were also thinking about how we should be using the council's assets. And for those of you who are familiar with how councils work, very often if there's an asset available, there may be 2 or 3 bits of the council that would like to have some use of it. So we have to kind of make our pitch for the use of the council's resources. But also clearly want to make sure that the council's priorities include the housing needs of older and disabled people. So what did we do? Well, the first thing was we looked at some of the research that existed already, and as you can see, 3 of the happy reports are mentioned there, because at the time when we did our research, that's what you were up to. But we also looked at some other information. Do recommend designing with downsizers, which is a piece of work carried out in Sheffield that very much involved people who would potentially end up using living in accommodation for older people. But actually what we knew we needed to do was to understand the needs of our own local population. So we commissioned an independent survey. I won't read out exactly what we did, but it was big enough to be statistically significant and for us to get some good quality information. And we looked at these areas. So propensity to move, in other words, were people preparing or prepared to move as they got older? What was driving people? What sort of housing they were looking for, both in terms of tenure and type? And also one of the things that we specifically were interested in is whether downsizing was real. We certainly, that's a phrase that's used a lot, but would it have any measurable effect in our area? There's a link in the presentation to the full report, which gets quite technical. But the best bits at the end, there's some of the feedback from the focus groups with some really useful kind of narrative comments that came back there. So these were the results. I won't bore you with too much of them, but I'll just hit the headlines. So the first one was around that propensity to move, and doing a bit of rounding. Basically, we ended up with about half of the population who were saying that they were either planning to move or were prepared to move if they. As they grew older. There were 40% said they didn't want to move, and about 10% said they'd already moved to something suitable. we asked people about the factors that were involved in when they were wanting to move home, and as you can see, location comes out very heavily there. One of the regrets I have with hindsight is that we didn't drill into what location meant for people. In other words, was it a particular town they were living in? Was it the types of facilities in the area, or was it a particular community? And I think if we were going to do that again, we would drill into that area a bit more. And then we asked people what kind of properties people were looking for. Now, the outcome of that was that there was a very heavy majority looking for bungalow accommodation, and we know that that's been difficult to achieve in new housing developments because of the land take. So but we need to be cognizant of the fact that that's certainly that single level accommodation is a real driver for people. So, and then we did the calculations around downsizing, and from our area over the period of the local plan, which was up to 2035, what we worked out was with the right range of products, if they're built in the marketplace, it would release 5,400 houses with 3 or 4 bedrooms, i.e. 3 or more bedrooms, i.e. Proper family accommodation. We also saw that owner-occupiers were very keen to retain that status, and that also included a reluctance to consider leasehold purchase, and I think that's an area where we will need to do some work in terms of hearts and minds around assuring people that actually within flatted developments leasehold is probably preferable, and it actually doesn't have too many downsides to it, although there have been some horror stories, shall we say, in some schemes, I know. Most people are looking for a home in a normal street rather than specialist housing, but about half would consider specialist housing. Very few people wanted 1 bedroom. Even single people generally had a strong preference for two or more bedrooms. And not surprisingly, given all this, we did get some information in the focus groups that people had looked unsuccessfully already for places to downsize to because of the shortage of suitable accommodation. So, summarising from the research, so there's clearly an untapped market for all types of accommodation for older people. The biggest shortfall is in mainstream housing. Many older people have the desire to downsize, but it's got to be the right product. And I think, unlike some of the other areas when we talk about housing, where we talk about housing need, these are generally people who have choices in the marketplace. So therefore, if it's not a better offer, they will stay where they are, possibly to their detriment, actually, in terms of wellness and lifestyle. I won't go through these in a lot of detail, but we worked out from the feedback that what the implications would be for Central Bedfordshire, and that's where we got that 5,400 homes from, which is about 23% of the planned housing growth. About 3/4 would be for owner occupation, but it would, as I say, it would release these homes, family homes. One of the things that we started to think about as we looked about how we moved towards delivery was having a clear definition, and whilst I think some of the definitions that exist already around Part M of the building regulations can be helpful, I think there isn't one that is quite right based on what was expressed back from the survey. So it's about accessible dwellings that are livable on a single floor, I think. And that may well be, it could be a dormer bungalow, but it's got to have a proper bathroom downstairs, and guest bedrooms perhaps upstairs, or storage space. What we've done is to do a definition and try to influence our local planning policies to promote development along these lines, as well as delivering specialist housing directly ourselves as a landlord. And also, we are aware that there really isn't very much in the market at the moment that we would call downsizer homes that have been built as to test out some of these theories. So we are actually planning to build some ourselves for sale onto the open market, and hopefully we'll have those built in the next couple of years. So looking at the key challenges, for me, I think historically the national planning guidance hasn't been strong enough, and whilst the new planning guidance that Claire mentioned is really welcome, it's only just come out, and the planning system is notoriously slow to kind of gear up and change how it does things. If you see a home being built today, chances are the permission for it came 4, 5, 6 years ago even. So it's going to take a while for this to come through the system. There's very little interest from volume house builders, and trust me, I've tried to get them interested without much success. I've even seen, this is the third bullet point, homes which were submitted for planning consent as meeting category 2 of Part M, which, to be honest, I don't think any downsizer would have been interested in them. You know, the fact that there's the space where technically you could put a through the floor lift, to me does not inspire me to want to buy a property if I might need to travel from one floor to the next and I can't use the stairs. So I think we've seen some of the volume house builders design down to the absolute basics of those standards, and not really been looking at achieving real accessibility. As I said, the downsizer home market is pretty untested. And I think finally, from my perspective, I think that whilst we've tried to engage generally with the population, the real voice of users of services and potential users is something that is yet to be fully heard in this area.
Thank you very much, Tim. That was a great presentation, and it's great that you're doing so much research into what matters to people and what's already out there and how you can plan to the future. And we've heard from Claire, who spoke about how important it was to have good partnership working and good leadership. Now Isaac's going to speak about the people with lived experience perspective on things. Thank you, Isaac.
So, good morning everybody, my name's Isaac Samuels. I'm part of the National Co-Production Advisory Group. So what I do, I try to ensure that the voice of people that have care and support needs is heard in terms of, and particularly locally, if I think locally, being involved in some of the forums where housing is discussed, and some of the challenges around ensuring that the voice of people that have care and support needs. So I'm going to talk about where I live. So when we talk about housing and a place called home, do we really mean a place called home, or do we mean a place for people to just stay and sleep? Often people find it really challenging because they're never included in the conversations from the beginning. In terms of where some of the challenge is, it's important that we ensure that people from a wide range of care and support needs are central to the conversations. Where I am, there's often regeneration projects around building new houses, and they build homes that are not accessible, or they build homes that are for types of people. So they will build, so recently they've built some homes, and they built homes on the assumption that all people with learning disabilities will want the same types of home. So inside the home they all look the same, and they're not accessible for everybody because they've never involved the people that they were building them for. I think it's really important to think about the impact that not having a home really has on people. And it's really important to ensure that when we talk about home, we really are talking about home, so people have the choices that you and I would take for granted. So when we talk about independence, do we really mean independence? So often a home can mean independence, but it can often mean the lack of interdependency. So ensuring that people have the right support to stay in the home that they're already in, or have a home where they have support come into them. I think it's really hard often to separate support and housing, because often where I am, housing comes along with the support that makes it a particular challenge. But it's really fundamental to ensuring that we have a really good market where people have a variety of choices, that people are central to those conversations. But it's not just the local authority, it's health, housing, education, but most definitely planning, and also that it's not just social housing that we're talking about. So this is my fountain that's really, really important to me, and I love my garden because I have mental health challenges and often I can't get out of the house, so my garden is my safe space. I recently had an assessment and I was told that I would have to get rid of my fountain because it was a risk. I might fall in it and kill myself. And it was quite interesting because there was this whole thing around risk, and I felt even in my own home I have very few choices around the types of home that I want to live in, and I have a professional come in and tell me that my home isn't safe for me, which was just absolutely ludicrous. I did challenge and had a conversation with a manager, and it was really interesting because it was a new person that hadn't known me, and they'd had a falls risk training the week before, so that kind of played out in terms of their assessment, and it was ridiculous, but it's the reality of most people with care and support needs and housing, that often people start institutionalising housing and actually forget that it's people's home. People have the right to design and have the types of homes that meets their needs. So making it real is a great opportunity. So what I did after my assessment, I gave the social worker the Making It Real document. I said, come back and think about what you've told me, and I want you to read this. And she went away, and to her to credit due, she went away and read Making It Real. She came back and we had some discussions about what was important to me and what she could do as a social worker. And one of the things that was identified where I live, that health and social care and OTs, and nobody seems to talk to each other, and there's lots of referrals that happen, and she was someone that said, actually what I'm going to do is I'm going to be the person that drives this through, because the frustration that I was having at the time, that well, actually this department deals with this, that department deals with that, I was getting lost within that whole system and not having someone that kind of navigated it for me, and she care coordinated from that perspective. So it's really important that you consider that everything should be around the person and what is important to that person, but what as an organisation do you need to do to make things happen for people. There are 6 themes in Making It Real, and living the life I want, keeping safe and well. This is so important. So often I'm supported to keep safe and well, but that doesn't necessarily mean that I live the life I want to. And my colleague Clinton will talk about the plant. So, people with care and support needs are washed and dressed on a daily basis, not to have any experience of anything outside their own home. So it's not just about a home, it's about being connected to the community, it's about having the same opportunities. And with the right housing, that is really, really possible. So it's not kind of having housing at the end of the housing estate, 3 bungalows for 3 elderly people, or some houses built for the learning disabled or people with mental health challenges, and there's a block of people with mental health challenges. It's actually having housing that is in the local community, that's accessible, that's lifelong standards, home, standards that can be adapted over the life of an individual. For example, having wider doorways, it's just an amazing thing for lots of people. So I've got lots of disabled friends, they can't come to my home because I have really small doorways, and so last year I had the doorways taken out and replaced, which made it really much more accessible for me and people that come to visit me, and that's really, really important, because I will be able to stay in my home forever. The 6 themes are really important because they talk about my support, my way, staying in control. Often people feel that don't have any control when it comes to housing. What they feel is that they have a housing need and they are allocated their housing that's available, and often that is based on an assessment, and you might have a place that's offered to you that is 70% accessible, but it's not fully accessible because actually you might have to move there and adaptations happen, and it's ensuring that people are really at the centre of any conversation and that people are driving it. It's really important that people have the right support to have these conversations. So my OT, the OT that works on my local authority, is just amazing because we spent about 6 months trialling different products on they were loaned to me and we trialed it, and that was remarkable because actually the previous OT wasn't even aware that could happen. So it's about kind of trialling things, it's about ensuring that you have access to things to see actually, do you really need that or do you really not, does it work, rather than committing to something that has a really big impact in terms of cost, but also once you've got it, you've kind of stuck with it. Living a life I want and keeping safe is the most important, and without the right housing this is not possible. So housing has to be accessible, it has to be affordable, and it has to be located in the local community. I think it's really important that people with care and support needs are included in all of the conversations. There are some examples of the I and we statements, so please do use them. The thing that makes no sense to me is that there isn't a joint function within my local authority around health, housing and social care, because often there's big arguments around housing versus social care, and actually to make things happen you need somebody that has oversight and that can really push forwards in terms of housing and social care and health. I think it's really important that people are central. If you don't get housing right, people won't be able to live the best possible lives, and housing is one of the biggest barriers to people with care and support needs, and if you get it right, people can have the best possible lives, and it can be in the least restrictive way, and it can support people to do wonderful things. The Making It Real I statements document is available, so please do use them, they're really great, and the ones around housing really to support a different conversation which really puts people at the heart of the conversation. Thank you very much.
Thank you, Isaac. I think you've given us some real key messages there. Don't make assumptions. Partnership working and engagement is really, really key. We must be balanced around risks. Trial things out, and if you get it right, it can be really, really good, and you can support people to lead the best life possible. And making it real is a really good framework to guide you through that. It helps you to have a really good conversation around what matters to people, and it allows you to keep it real. Thank you, Isaac. Are we going to open up for question and answers now? And we have certainly got some questions for Tim, if that's all right.
Yeah.
I've just got to read my colleague's writing. So which department is driving these initiatives?
Well, within Central Bedfordshire we have a combined social care, health and housing directorate. Its focus is social care and housing, and we've got a single director. So what that means is, I know some authorities, they will end up with arguments between the housing bit and the social care bit. At least there's one person who can kind of step in at that point and make a decision. And certainly as a director, she's very much championed the joining up of social care and housing, and the fact that just the contribution that social care can make to, so that housing can make to meeting the needs of people with care and support needs. So I think that's very helpful. I have to say also we've managed to convince our politicians of the case. In fact, I think been a bit too successful there, because I think we've got a leader who thinks that if we build enough of the right properties, he won't have to have a social care department any longer. Now I think we need to make sure he doesn't. He perhaps understands that there'll always be people who will have care and support needs. But absolutely, there. If we imagine a world in which, if we waved a magic wand and every home was accessible tomorrow morning, what a different place it would be. And now getting from that to where we are today to that is not possible. But it gives us the place to think about what how people would live their lives very differently.
And do you
if
think,
they have the right accommodation.
Do you think that it helps to have a director of adult social care who also has a housing responsibility within her portfolio area?
It definitely doesn't do any harm, certainly, and we have, we certainly have made it clear that our how we operate our landlord service is not looking at it purely as a landlord service, and I think that can be quite difficult at the end of the day. Certainly, housing associations, some of them have very much taken on board the kind of understanding that they have a role in the whole system here, but others very much see themselves as landlords, and their function is managing the stock that they've got, which could be. Those generally aren't the housing associations who we're working with.
There's another question here, Tim, that says, how did you get the views of service users through research?
Yeah, the details are if you when you look at the presentation, if you look at the main report, it actually sets out exactly how we did how the survey was undertaken. But basically, it was done by an independent research organisation, and they contacted 600 people over 65 selected at random, using some methodology that they've got with people within Central Bedfordshire. And certainly the methodology for the survey was designed to be one that could be repeated either by us in the future, so we can test if things have moved on, but also by other authorities if they want to look at into these areas themselves.
Thank you. And what type of response has your report received so far from housing associations and different partners and colleagues?
It's interesting. I think that's the one. In terms of housing associations, I think we've got local housing providers, some of whom see themselves operating in this area, but as I say, others see themselves as essentially mainstream landlords and kind of think, well, what's in it for us? Also, I think that at the moment there's been relatively little development. So if we're talking to housing associations about new schemes, then I think by and large they understand this agenda. To be honest, if they didn't, well, we probably wouldn't be talking to them. But I think there is a kind of a bit of and Claire might know a bit more than me about this. Seems to be a dichotomy between what are called specialist housing associations, who perhaps have a national presence and are used to delivering specialist schemes, for want of a better word, and those local housing associations who are mainly providers of mainstream housing and perhaps not a lot else besides. But if there's a major housing provider and it's in our area, then we keep beating on the door and hoping they'll listen to us.
I think there are some signs that more of the big housing associations who perhaps don't have a specialist interest in particular types of specialist housing are recognising that they need to understand the needs of their older residents. I think partly because of just demographics, but actually a significant proportion of old people living in housing association properties, of people living in housing association properties are in that older age bracket. So even if you don't provide specialist housing, you still need to have a good understanding. If you're going to sort of future-proof your organisation, you need to have a really good understanding of the needs of those old people. Certainly the Housing LIN is working with several of the big housing associations who are actively exploring what this means for them. And I think that does provide an opportunity to kind of begin to broker some of those new conversations.
Yeah, definitely. definitely. So, Tim, how have you managed to persuade your planning department to come on board and participate?
Was it? Good question. We've always had a good relationship with our planners. I think I do understand the pressures that they're under from all sides. And one of the reasons for doing the survey was to get that evidence base, because at the end of the day, the planners will give me a polite hearing if I say, look at these people, they're all out there, but they'll say, how many of them, where are they, what are their needs, what kind of property do they need to live in, and that's what we've tried to do through the survey. I think the new guidance is very helpful, actually, because we can kind of say now, right, okay, not only have we got the evidence base, which is what the guidance actually asks councils to do, by the way, but we've now got a methodology for using it. I think it could be stronger. I don't think there's any question about that. There's lots of coulds in that guidance, and should or may. If it said must in a few key phrases, it would be much more helpful, I think, because we know that the volume house builders essentially will challenge all of the decisions that councils make, all of the policies that councils put in place, which will affect what will they perceive will affect their bottom line.
Well, this is a related question, actually. It's probably for yourself and Claire. Do needs and intentions differ between people above or below social eligibility or financial eligibility?
From our perspective, no. By and large, we know that we always have some fairly complicated discussions about whether people have a need for social housing, and also if they have a care and support need. That's two completely different assessments, and you can have one and not the other, and have none of them or both of them. But actually, I think that by and large we try not to worry about that side of things too much. Especially, I think with the Care Act, I think that the Care Act has made eligibility much less of an issue. And it actually is good from that perspective. So, for example, I think before the Care Act, very often the idea that people were lonely was not really considered to be a social care need, whereas I think now, post-Care Act, that's quite clearly acknowledged and is a good thing too.
And I would agree with what Tim said, and also, I don't know, it's quite a complex question, but I think actually that there are some different challenges in different parts of the market. If we're thinking about financial eligibility for social care, and as you said, that doesn't always correlate at all to kind of need for affordable housing, but it may do. But equally, there is a shortage in terms of accessible housing being developed across all aspects of the market, and there are many people in middle and higher income brackets who also don't have housing choice. Because of the challenges we've already referred to, and the perceptions that accessible housing isn't kind of an attractive or even kind of going to help the sale of a property in the market. So I think that there are challenges across all income groups. If this is a question about affordability, as much as anything.
Okay, thank you. I'm conscious that I've left poor Isaac out here. So I'm going to ask you what happened about your founding.
So I had a discussion with the head of social care, and we used it as a really positive learning tool around positive risk taking. So rather than people coming into people's homes and making decisions around risk, there was a discussion around risk, and we identified that it wasn't a risk, and if it wasn't the risk that was assumed, and I was happy to take that risk on.
Are you able to influence people to think about, professionals to think about the housing agenda more than they actually do at the moment to improve health and well-being?
So where I live, there has recently been a lot of investment in new developments, and some of the community spaces, community meetings where the developers, the local authority and the local residents who come together have really changed the kind of conversation. It's really ensured that actually, and a reputational thing that developers have really cottoned onto, it's really important to engage people, and I think they would have never done that unless there was a forum provided by the local authority, who are the commissioners of the new housing stock. But it's really meant that the end product is much more based on what people need, and they've been really responsive. And also having a public space where you can hold people to account is really, really important. And there's been all sorts of people that have come to these meetings, and it now feels like, rather than the developers over here and the councils over here, that actually having regular meetings, people are kind of working with the same hopes and aspirations. Some of the tension is always around, is it profitable for the developers? But they're much more able to kind of look at kind of sharing some of the risk around profit as well, which has been really interesting.
Okay. That's really helpful. Is that community kind of feel really, really important to you as a person?
The sad thing is, I know so many people that live in places that they don't want to live in, just because they're accessible, and actually the housing becomes the barrier to them living the life that they want to live. Too many of our peers too many of our people I know that are learning disabled live in accommodation that's built for that particular group of people, and they have become so isolated and dependent on services. So for me, it's how do we have a market that supports people to be less dependent. So we have local plans around integration, loneliness, isolation, connectivity, all of those sorts of things. But then we go and build 5 flats for learning disabled people, and the only people they have in their lives are the people that support them. And I think that we need to be much more thinking about how do we ensure that housing supports people to be less dependent. People may need some support, but it needs to be the least restrictive. It needs to be supportive of people connecting to other people. It needs to be planned in a way that makes sense of the local environment. So for me, it's like, how close is it to the bus stop? How close is it to people getting around? Is it safe? Is it accessible? Does it support people to live the best possible lives rather than become institutionalised? And I think some of the previous attempts at ensuring that housing was available for people with mental health challenges, learning disabilities and older people were kind of projects within bigger housing developments that clustered people together, and I think that's really not the way that I want to live. I don't want to live in a ghettoised kind of housing provision, and also it's kind of it kind of undoes some of the stuff around how do you ensure that people feel connected to their neighbours, and if you live in with all people with the same kind of needs, you're not going to feel connected.
And I guess to counterbalance that, Tim, how are you building that sense of community into the strategies and plans that you're developing in Central Bedfordshire? And Claire, how do you encompass that into national context and policies and frameworks that you're looking at in the housing lane?
I think in terms of, I have to say I agree with everything that Isaac said, and I think we should be pretty sanguine about the challenges that associate with what he said. I know that when we start to talk about, so we can end up in situations where we've got a new estate being designed and built, being designed, and the developer will be talking to the planners, and the planners will be saying we need all of these things, and this is the social housing element. Is the social housing element going to go in the nicest bit of that estate? I'm sorry, it isn't. And certainly when you focus simply on having a numbers game, i.e. yes, we need 6 of these and 10 of these, it's very unlikely to happen. It needs to be part of the master planning process, which I think we do see good examples of that happening. But actually, I think realistically, in order for that to really get some traction, there needs to be a stronger legislative push towards it actually designing and building inclusive communities. which isn't about segregating people and putting this group of people in one bit and another group of people in another. It's about having, and to be honest, going back to if every single property was accessible, that would be probably fix about 90% of the issue.
Yeah.
I know I have to say that's a little aspirational, to say the least, but it's certainly what we'd all want, I think.
It's a big challenge. Claire, is there anything that you want to add?
I suppose just reflecting on the kind of the Housing Lynn sort of outputs and the kind of range of examples and sort of perspectives you'll find if you look at our website. Bricks and mortar is really important. There's no question, of course it is, and but communities are also more. And I don't think those two things are. It's not a zero-sum game. I think all of these things are true at the same time. And we have lots of conversations and promote lots of examples where kind of developing communities and kind of supporting relationships plays a really important role in kind of the world of housing and care. So, but also there's the link between the two is clearly the kind of design and the location of housing. So you can do a lot to encourage community through good inclusive design, both in terms of the actual property and also in terms of the wider community. I'm just reflecting on the work that I was aware of when I was working in Medway Council, where the planners were working really closely with public health team on developing or ensuring the new local plan was dementia friendly. So actually that will have some wider benefits. I don't know what happened with that, but it's a really interesting idea, and I think that will have wider benefits in terms of other groups as well, who perhaps face some similar challenges and need some of the same kind of all of what we mean by dementia friendly, about enabling people to access their community and access each other.
Thank you, Claire. I've got one last question for you. Do you think we're using technology enough to make housing more personal for people? And I guess that's a question for all of you really on the panel.
Do you want me to say something?
Yeah, please do.
So I think there is some progress. There definitely is some progress, and there are some local authorities and housing associations and care organisations and all three who are making some real strides in this area, but it is very slow. One of the things that I think will achieve real change in this area is when the manufacturers and developers of technology understand that in the future their primary customer group will not be commissioners but will be people themselves, because that is where the huge explosion in the market will come. And I can't help thinking it'll be when Google or Amazon recognise that is a real potential in the future, that we'll see real shift in this area. But my concern is that some of those big interests don't necessarily have the same kind of interests that we might have. So I think it's a really good time to be talking about this, thinking about this, about ensuring that actually we do have what we want in our lives, whether it's about care and support, whether it's about entertainment, whether it's about communication. These things are not kind of separate things, and that we increasingly see this as not being a taboo thing, but you might have your entertainment system which then could kind of offer care and support add-ons in the future potentially. I just wanted to mention Blackwood Housing Group, which is a Scottish housing association, which I think is doing really amazing work in this area. It's definitely worth a look. You can find some information on our website about their Clever Cogs technology system, which is at the heart of their personalised model of care and support in their housing.
Brilliant. Tim, how are you incorporating digital in your strategies and your planning in Central Bedfordshire?
I'm not sure I've got much more to add to what Claire said. I think one of the areas that we are looking at, as well as the technology aspects, are the construction side. And the example I give, if you could transport a bricklayer or a plasterer from 100 years ago and put them on a building site today, they could be working within 10 minutes. The industry has not primarily changed, especially at house building. And I think there are some opportunities there around technology to get stuff delivered quicker, better, and be more intrinsically adaptable. But I'll give Isaac a bit of an opportunity.
So for me, I think this is a really interesting time that we're in, and we should really keep our eye on the ball. I think that technology is a game changer. I don't think we've actualised it in terms of the full benefits, because I think it is very dated and very based on not including the end user in some of the developmental stuff. I think it's very much left to a particular part of the sector, and I think the minute technology becomes more around the kind of stuff that we take for granted every day, you know, there's the advert at the moment around Alexa reminding people there's a nice yogurt there if you've got a memory thing, and I think that we will move into the space of technology supporting the right care and support, and be really supportive of the environment and housing. I think it's underused often, and I'm looking forward to the development of technology that is on the same parallels as all the other kind of developments in terms of, you know, apps and accessibility and all that kind of stuff. I think it will be a game changer for lots of people.
Thank you, Isaac. I'm really sorry we haven't got much time for any more questions and answers, so I'm going to bring it to a close now. Today we've heard about and discussed some of the challenges with care and supporting accommodation and why a place should be called home. The secret, I think, is that we can take home with us wherever we go, as long as the conditions are right and we have the things around us that matter to us and that are important to us. It can be done. I hope today's been helpful. Please do look at the TLAP website for any links following this website, and do share with colleagues, because we want to grow innovation. If you've got any good examples to provide to TLAP, then please do get in touch. We'd be happy to ping those around and showcase those examples for you, and I'm sure Claire and Tim will do as well, and so will Isaac. So thank you very much for your time.